My name is Beatrice from Nairobi, Kenya. I was diagnosed with aortic aneurysm 2 months ago at Nairobi. And back at Nairobi, the doctor advised us that my case was so complex and I needed urgent surgery. So we tried to get professionals who would deal with my case, and everyone will advise I come to India for treatment. We tried to find ways to come to India, and through a friend we were able to get Apollo Hospital, where we were given the contacts for the amazing Dr. Niranjan Hiremath.
We are talking about Miss Beatrice, who is a pleasant 31-year-old lady who came to us along with her husband, traveled all the way from Kenya in Africa to seek treatment for her complex thoracoabdominal aortic aneurysm. It is basically ballooning of the entire aorta right from the chest all the way till the bottom. And the problem here is it can rupture any time and it can cause sudden death.
It took me around 3 months because the pain was not going away. It was just there every day, every night, the pain was there. I could not sleep on my left side because of the pain.
Fortunately, we have a comprehensive aortic program here at Indraprastha Apollo, and we deal with all kinds of complex aortic issues, including endovascular and open treatments.
And he assured me that he was going to fix my problem. He promised that I was going to be okay and I would recover very well and very soon.
Beatrice underwent a successful open surgery and open reconstruction of the entire aorta using a unique technique that we use and devised to mitigate blood loss and to also reduce complications during the surgery.
Apart from that, other protective strategy we applied is provided single lung ventilation with the help of EZ blocker. It is much physiological, and one lung ventilation was achieved successfully. And with these two techniques, and apart from the routine general anesthesia and providing the optimum operating conditions for the patients.
Dr. Niranjan is an amazing doctor. He has patience, but to me I consider him family because he literally saved my life. I don't know if I'm describing him well, but he's beyond amazing.
She made a remarkable recovery in about 10 days and was discharged in a great condition. She was able to walk independently and do all her work independently.
The nurses, sisters at the ICU, I would call them every now and then, and everyone will come and listen to what I was saying. I would even complain for nothing, but they were there. They will just listen, give me water. They will do everything that a bedridden patient will need. Everybody treated me so well. Give my appreciation to the amazing Dr. Niranjan Hiremath. Thank you so much for saving my life, and to the entire Apollo Hospital. Thank you so much.